Good afternoon, everyone, and welcome to the Florida City and County Management Association webinar entitled Homelessness in Florida, the Sarasota County Experience. My name is Bob Lee, and I have the pleasure of serving as your host today. Joining me as co-host is Dr. Dina Hurst and Mr. Mike Ryko, both employed with the John Scott Daly Florida Institute of Government. Dina and Mike will be the people coordinating our webinar technology today and assisting attendees with questions. Sponsors for today's webinar include the Florida City and County Management Association, the Florida League of Cities, the John Scott Daly Florida Institute of Government, and the Center for Florida Local Government Excellence. Corporate sponsors include Government Services Group and Strategic Government Resources. For those who have not participated in an FCCMA webinar before, I want to direct you to the control panel located on the right side of your screen. Specifically, I want to refer you to the chat Q&A window. This is where you may type in any question or your questions that you may have for today's presenters, or if you are experiencing any technical difficulties, for Mike or Dina to assist. We always do our very best to respond to all the questions and make sure that the presenters have those questions to respond to as well. At this time, I'd like to introduce today's presenters. Our first presenter is Kevin Stipp, and he's the City of Sarasota Community Care Court Coordinator. Welcome, Kevin. And before I introduce the others, would you mind briefly summarizing your background for the attendees here today?
Well, first of all, I'd like to say good afternoon, everybody, and thanks for attending. I am Kevin Stipp. Like I said, I'm the Care Court Coordinator. I have recently retired from being the Coordinator of Homeless Response for the City of Sarasota, and that is after a 37-year law enforcement career. I served 3 different agencies, including the military police. I retired as a captain of the police department in 2017, having served as a commander of explosive materials units, commander of special weapons and tactics. So as you can see from my bio, I am not a social worker. I got involved in this kind of by accident, but since the involvement, it's been my development and issues in this have always been, we need to develop a system on outcomes, not outputs. And I'm also new to webinars because I showed up in a suit and tie today.
Okay, I enjoyed that. I can't say I have a suit and tie on. Kevin, we're really glad to have you as part of this panel, and I know you're going to bring a little different perspective, which I think is going to be informative for everyone. Our second presenter, if we'll put that slide up, is Nancy Deloach. Nancy is the Homeless and Poverty Policy Coordinator for Sarasota County Health and Human Services. Welcome, Nancy, to you as well. And would you mind briefly summarizing your background for today's attendees?
Sure. Thank you for having me. Good afternoon. As Bob said, I'm Nancy Deloach. I've spent the past 26 years working for Sarasota County Government Human Services and the last 6 as the Homeless and Poverty Policy Coordinator. In this role, I monitor homeless and poverty initiatives within Sarasota County. I conduct analysis to identify strengths, deficiencies, and gaps related to the system, and then assist in developing and implementing improvements. I promote community collaboration and partnerships, and I work with organizations to resolve conflicts and try to keep everyone moving in the same direction toward a common goal. Prior to Sarasota County government, I worked for our local youth shelter, and prior to that, I worked for the state of Georgia with developmental disabilities programs. In all, I have about 25 years experience working in human services. And thank you for having me.
Thank you, Nancy. And again, the background you have is certainly going to be valuable. I would say, particularly for the questions that may come in, you and Kevin both have a good background that will be able to address a lot of those, I'm sure. Our final presenter is Tara Booker, and Tara is the Chief Operating Officer for the Suncoast Partnership to End Homelessness. And we also want to welcome you, of course, Tara, as well. And if you wouldn't mind also summarizing your background, please.
Sure. I am the COO at Suncoast Partnership to End Homelessness. I've been there for about 3 years. I also served as the interim CEO for about 6 months at the Suncoast Partnership. We are the lead agency for the Continuum of Care, which I will abbreviate as the COC throughout this presentation. And for anyone who may be unaware, a COC is a federally mandated program that requires coordination of community systems and partners to work towards preventing and ending homelessness. I have a master's in nonprofit management from UCF, and I spent 6 years at a large social service agency in development and community engagement, and then as director of veteran services over a multi-million-dollar supportive services for veteran families, or SSVF as it's known, federal grant to serve veterans and their families who are homeless or at risk of homelessness. My 2 fun facts I'm going to share about myself is I briefly lived on Standing Rock Indian Reservation in Fort Yates, North Dakota, and I have rescued numerous baby squirrels.
Thank you very much, Tara. And again, I think with your background combined with the other 2 presenters, we're really having a formative presentation ahead of us here, and looking forward to it. Let me go ahead and turn the program over to you 3 now, who I understand are in the same location. And so if you want to just go ahead and take over the slides, we'll begin the program.
Thank you.
All right, let's talk about what we've achieved. And we have all been involved in this for quite a while. So sometimes you look at a system and say, well, have we really made any difference in the system? So I had the Continuum of Care run an emergency shelter number. An emergency shelter number was the only number we were able to run since there's been so many changes in our system and how we collect data and what we do with it. So we're able to collect emergency shelter entries from 2011 to 2014. And we did the same period from 2015 to 2018. You can see from the slide that over 4,200 individuals were served at the Salvation Army Emergency Shelter in those 4 years. And out of those individuals that went in there, only 1.76% of them actually end up in housing. And of that 1.76%, 33% were the only ones that remained in housing after 12 months. And the reason that is, I believe it is because the system was not focusing on outcomes. It was focusing on outputs, the number of bed nights, the number of meals served, and what they were doing as a service provider. But we changed in 2015 to 2018 to outcomes. And we served more individuals in that time frame, over 6,200. But as you can see, 873 people ended up in housing in that 4 years as opposed to mere 75. And if you went to housing with our new case management and wraparound services, you had a 72% chance of remaining housed for 12 months. And the most important number when you're talking about cities and counties and how your governments have to deal with homeless complaints and issues that are occurring on the street, 26% of those individuals that we housed, 230, were chronically homeless individuals that we frequently had issue with on the street. So that's how a system can change and you really don't even see it happening.
This slide shows our point in time numbers between 2016 and 2019. The point in time is a federally mandated survey of those experiencing homelessness that happens once a year on a single night. It is typically the end of January. All of your communities should have recently completed this process as it's done nationally. The PIT numbers are only representative of a single night, so it's not the most precise number of a community homeless count, but it is a very valuable snapshot of data to help identify and analyze trends. PIT numbers are used at both the federal and local level for informing funding, community planning, and increasing community awareness around issues of homelessness. I've highlighted the bottom. We saw a significant change in our numbers in Sarasota County, and most notably in the City of Sarasota from 2016, where we were pre-coordinated system to 2019 after we implemented our changes in coordinated entry and our homeless crisis response system.
That this reduction is impacting other areas of our community as well. Our Sarasota County Fire and Rescue has reported some significant decreases in calls for services from homeless individuals. There was a 28% decrease from 2016 to 2018, followed by, in 2019 alone, there was a 36% decrease in calls. Overall, there has been a 54% total decrease over the 4-year period. So from 2,052 calls annually in 2016 down to only 950 in 2019. Additionally, when you consider that 80 to 90% of those calls result in a transport to the hospital emergency room, the savings to the community is even more significant.
You can see that change, and a lot of that change also takes place with the fact that there was a lot of training conducted for law enforcement officers as it relates to protective custodies and outreach.
So we wanted to start the presentation on a positive note and show you some of our successes. We have realized some incredible changes in our community, and we're very proud of that. But this has most certainly not been a straight or easy road. So we will spend the rest of our presentation sharing all the challenges, the hows and the whys, with the hope that we can help you all learn something from our journey.
But first, a little bit about Sarasota County's demographics. Sarasota County has a population of a little more than 400,000 people, and our median income is about $7,000 more than the state average. Our region is number 6 in the U.S. with the highest number of millionaires. Our average age is 12 years above the state average at 53 years of age. Some of us in the room are above average, and one of us is below. About half of our population is in the workforce. On the flip side of that, about a third of our households live below the ALICE threshold. And if you're not familiar with that term, ALICE stands for Asset Limited, Income Constrained, Employed. The ALICE threshold represents the minimum amount a family would need to earn to be able to meet their bare bones basic needs. Also, more than half of our school-aged kids are on free and reduced lunch. We have approximately 3,000 unique adults that are entered annually into our HMIS system, which indicates that they received some type of homeless or homeless prevention service. About 1,000 school children are identified as homeless over the course of the school year each year. So in summary, there's a lot of affluence in our community and a significant number of individuals and families living on the economic edge that are only one job loss, one medical issue, or one major car repair away from being at risk of losing their housing. We're really fortunate as well to be the home of 2 large community foundations and several large family foundations, and we partner with them every chance we get.
So you're asking yourself, how does this happen? How does a city that was dubbed the meanest city in America by the National Coalition for Homeless in 2006 in 2017, the ACLU said, we don't deserve that title anymore. We have become progressive. It happens out of a lot of change, and we have done this not only through system changes, but thought process changes, and then we've also done it while still enforcing laws in our public space. Also in 2013, we had an issue that one of the judges agreed with the ACLU, American Civil Liberties Union, that our panhandling ordinance was a violation of the First Amendment. So we stopped being able to do any panhandling enforcement at all, which greatly increased our homeless population, as well as there was a homeless person on every corner doing panhandling. And at some point, a story was ran that the city of Sarasota had twice the population of homeless individuals for a city of its size in the country. So we had a lot of pretty good explosion back in 2013, 2014 with our issue. And if you're a city that has decided to get involved in dealing with homeless issues and complaints and trying to figure out a way to respond, I am sure some attorney somewhere has referred you to see Pottinger. It is an agreement between the ACLU and the city of Miami that discusses life-sustaining conduct and how a law enforcement agency or a city, county should be involved in contacts with homeless individuals and what they should do and what they are allowed to do in their public space. But we found that as a city that we really had to respond somehow. But I understand, and everybody begins to understand, that the way a government sees a homeless problem and the way a social service organization sees a homeless problem is completely different. A city sees it, or a county, city and county and government see it as an operational issue you deal with every day. Every day, your city is getting code compliance issues, civil issues with civil complaints. You got officers responding to criminal complaints. Citizens and commissioners, how do you respond to their complaints about homeless individuals in your community, other than a lot of cities went to the point of there's nothing we can do, they're homeless. Then you have law enforcement officers dealing with protective custodies, which include Marchman and Baker Acts. And how do you govern and protect your free space? I mean, a city and a government has a right to protect their free space and make sure that you're able public safety, commerce, or situations that you can do something about other than just walking away from it and telling them there's nothing you can do.
Whereas the social service agency sees it very much individually focused. We're living and breathing and working on the same problems every single day like government is, but from the perspective of how can I help this one person, or how can I help this family? How can we serve them? How can we solve their problems? And the COC lead agency lives in this space where they can see the big picture and they can see the government and the public side, and they can see the micro of it and understand the social service and an individual related side, and has the mission to try and bridge the public and the social service side so we can all align on the same page.
So, as is usually the case, we had some challenges getting everyone on the same page, or at least in the same book. Along about the middle of 2013, our local foundations and our local newspaper identified a national consultant for us. And the City of Sarasota and Sarasota County hired that consultant to identify some homeless recommendations for us. Those recommendations were completed around November of 2013. Along that same time, the Board of County Commissioners established addressing homelessness as one of its priorities or board initiatives. So that first report had 12 recommendations that were basically split into three categories: families, adults, and system improvements. The family recommendations were implemented very, very quickly and involved small intake portals or small family shelters, master case management, HMIS utilization, and a campaign against summer hunger. From fiscal year 2015 through 2019, the family portal served over 500 families with nearly 700 adults and more than 900 children. 76% of those families exited shelter to some form of housing, either shared, transitional, or permanent. Each of those families was also offered a master case manager for them for up to 18 months to assist them with navigating the system and permanently resolving their issue. All of the agencies agreed to use HMIS to assist in data sharing and tracking. And the campaign against summer hunger provided food and funding to our local food bank enabling them to provide food for children over the summer when they weren't attending school. The adult and the system recommendations faltered at that point due to a lack of support. And those recommendations included a large come-as-you-are shelter, a relocation of street feeding, some ordinances, COC leadership improvements, and increased housing options. If you'd been in Sarasota County during that time period, you would have thought that the large come-as-you-are shelter was the entire recommendation for addressing homelessness. So over the next couple of years, our community was somewhat divided, and the City of Sarasota and the county were divided over philosophy, shelter locations, funding for serving adults, et cetera. And we kind of went on our own for a little while there. And the city hired started their homeless outreach team. They hired their first homeless director, and the county developed a 20-bed housing program with referrals that came from the sheriff's office only. And as you might imagine, adult homelessness lacked any significant improvement during that 2014 to 2016 time period. And at that point, the county kind of took a step back and took more of a low-profile approach and allowed the city to further explore their philosophies and their programs. You want me to go? Okay, but we didn't give up, and hope on the horizon emerged in the form of the Florida Housing Coalition. The City of Sarasota hired the coalition to provide recommendations on housing for our homeless adults. And while the consultant's scope was specific to addressing adult homelessness within the city, the county and the local foundation staff were invited and quietly participated in the research and provided input into the recommendations.
Yeah, I was at the social service side of the continuum of care during this process. So they did sit down with a number of service providers within our community, as well as the lead COC agency, to learn very specific details about program delivery, program philosophy, and to really assess and measure the connectedness that was occurring, or more importantly, wasn't occurring between the social service providers. And they did a great job gathering the viewpoint of not just the nonprofit leadership, but also those that were working on the direct line, frontline staff, working directly with clients.
Also during this time, the City of Sarasota, we started homeless outreach teams. The police department, as I was the captain of the police department, we were always responding to complaints about chronically homeless individuals on our streets. And we knew that no solution to homelessness was coming quick out of the recommendations from our expert, because there was no agreement. But still, the officers in the city was having to respond somehow to citizen complaints, and we couldn't send the officers out without any tools to handle the problem. So we developed homeless outreach teams and began training our officers on educate and encouragement before enforcement. This did not only start homeless outreach teams and give us a way to bridge individuals that are homeless to services, it really changed the philosophy on how the city, the officers and the city employees interact with homeless individuals from day one. So it was more of a city response toward services than enforcement. So we began to build a bridge to services. But as I tell you later in the presentation, we sometimes have to make sure we know where that bridge heads.
So from the study that was done by Florida Housing Coalition, they released the report, Creating an Effective Homeless Crisis Response System, which I believe we provided as a handout if anyone's interested in reading it. This homeless crisis response system is really based on national best practices for ending homelessness as promoted by National Alliance to End Homelessness, the United States Interagency Council on Homelessness, which I may refer to as USICH throughout, and the VA. But the report was customized specifically for our community. This report is very specific to the single adult population, as that was seen as the critical problem from the city and county perspective. But it's really the same system components that are relevant for all populations when you're looking to have a system that effectively responds to and ends homelessness. I did provide links at the end of the presentation, again, if anybody's interested, to USICH and the National Alliance, where you can find a lot more information about these systems and the system components, specifically as it relates to different subpopulations, such as families or unaccompanied homeless youth. But going on about this report, the report outlined changes and best practices in key system areas that we needed to address in our community. Outreach, which focuses on how we are engaging those who are chronic and long-term homeless on the street. They're the most vulnerable and in need, but also the most resistant to services and the least likely to engage with service providers. Outreach teams need to work together, be persistent, and ensure that they're connecting people to the service system through coordinated entry. Sometimes communities tend to kind of let that population go because, again, they're not really willing to engage. It takes a lot of persistence and a lot of effort to engage people that are homeless on the streets. The next other system piece of diversion and prevention, this focuses on how do we keep people from entering the homeless crisis response system to begin with. Having problem-solving conversations with people to help them identify their own resources and resolve their own crises wherever possible without using our limited resources. For a community to end homelessness, they have to have a strong front end of their system so that they can prevent people from ever coming into the system in the first place. Coordinated entry is actually a federally mandated system component, but also an absolute best practice because it provides a way for us to identify all of those that are in need in the community. It provides a common assessment so that whether somebody goes to agency A or agency B, they're getting asked the same set of questions and having their acuity of need measured in the same manner. And it allows us as a community, and specifically the COC, to triage people for services so that we can be sure that our limited resources are going to those that are most in need of assistance, those that without our help will never be able to end their homelessness. Emergency shelter is another key component to ending homelessness. It provides safety and some stability. Unsheltered homeless have a death rate of nearly 3 times higher than sheltered homeless. For shelters to be effective, they need to be low barrier and housing focused. Low barrier shelters provide access without requiring participation in programs or other restrictions such as sobriety. And when I say sobriety, I mean that they don't have to be sober to enter. I'm not saying that it's okay to drink alcohol and use substances in the shelter or on the campus. While Sarasota is extremely fortunate to have a good amount of shelter available for single adult individuals, which is not the case in many communities across the country, there were still a number of barriers in place at the time of this report, and often the focus was just on providing the services of overnight shelter without a focus on how can we connect individuals quickly to services in order to end their homelessness. Rapid rehousing is a key intervention for ending homelessness, and in our community, our rapid rehousing programs weren't necessarily operating in a housing-first approach or with best practice models of service delivery. Housing first is an approach guided by the belief that people need basic necessities, like a place to live, before they can work on other issues such as sobriety, budgeting, employment. It works to dispel the myth that people need to earn housing or prove they are worthy of housing. Another key best practice to rapid rehousing that had been really missing in our system was having customized service plans and utilizing progressive engagement techniques. Rapid rehousing is not meant to be a one-size-fits-all type of program. You really have to design a case plan that works for that individual, and it needs to be provided in the amount of time that that person needs. You can't just say, we're a rapid rehousing program and we assist you for 6 months. That may be fine for some families and individuals, but some may need much longer. The last piece to the crisis response system is, and the most critical piece when you're addressing chronically homeless, is the permanent supportive housing. It's intended for those that have very high intensive service needs. Permanent supportive housing provides that intensive case management piece and the financial support, and they do it without a time limit. I will add in there that permanent supportive housing isn't necessarily meant to be permanent. You always want to be working clients to empower them to be on their own and have stability. But the key thing with permanent supportive housing is there is no time limit. If it takes that person 3 years, great. If it takes that person 8 years, that's great too. Most people who are chronic and long-term homeless will not ever successfully end their homelessness without this type of intensive intervention. The report identified this as a very critical need in our community. We had and still do have a very limited amount of permanent supportive housing beds available. And the ones that we had in operation were not operating to the best practice standards as recommended for permanent supportive housing service delivery. I could keep going on and on about the homeless crisis response system because I have lots of information, but I would just either ask questions at the end, or if anybody wants to reach out to me, I'm happy to go back to these system components. But in addition to focusing on these system components, the report called for some changes in the structure and the capacity of the COC and the COC lead agency to strengthen it. And thankfully, this time, both the city and the county were in agreement on this report, and they both adopted it and directed staff to implement it along with the continuum of care.
So what does that mean to us government, right? And that's kind of worth the point. Why did the city and the county get involved? Most of the complaints we get as a government are not about a family. You get some complaints about a family, but everybody wants to help a family in homelessness. Cities and counties get complaints about chronically homeless individuals that are sitting at the same spot every day, panhandling it every day. And how are we dealing with them? Well, when our continuum of care said, we're ready to start using a by name list, and we're going to work with those individuals in your community on that by name list first. So that's going to include those chronically homeless individuals that your law enforcement officers and city employees and commissioners get complaints about all the time. We're going to address emergency shelter. Free food, free shelter, and free clothing does not end homelessness. When you have a shelter that is low barrier, but is housing focused, you begin to move people through a system. So that's how our systems align. As a city or as a government, what do we want to do? We want to reduce the number of complaints we're getting about homeless individuals. That is our deliverable. Now, it's perfect that we're also housing people at the same time. So we were able to align our objectives. We decided on an implementation plan through the Florida Housing Coalition recommendations. We had operational alignment. We were all going to work on the same groups, and we knew what our deliverables were. Our deliverables are people going to housing. We were ready to move forward. We had a good plan.
So we all continue to work together as an implementation team, and we made some real key changes within the COC, which included separating the lead agency board and the COC board into two different entities, so that the Suncoast Partnership as an organization had their own board that was focused on their governance and their financial abilities and capacity. And the COC had a board, which we call the Leadership Council, that was more diverse and representative of all the sectors of the community that need to be involved to effectively address homelessness in a community-wide fashion. This Leadership Council includes representatives from the business community, hospitals, housing authorities, local government, school systems, law enforcement, service providers, and also those who have lived expertise in homelessness. Bringing all of these viewpoints together at the table has enhanced our ability to coordinate across systems.
And also importantly, as a government, in 2014, someone said continuum of care, and the response was, "What's that?" And I still hear it from governments, "We need an agency that works on homelessness." Well, you have one. It is called the continuum of care. But as I spoke about in 2014, we started homeless outreach teams. We weren't really sure, when I said it was the bridge to service, we weren't really sure as a law enforcement agency or a city, all those people we put on that bridge to services, where it was going. And we found out as we approached 2015, 2016, well, there just wasn't a lot of services being offered to the individuals we were putting on that bridge. But with our leadership board, our continuum of care becoming now responsive to what our needs were and our mission was, we were able to say, get funding for them from the city to say, we need them to be able to accomplish this mission for us. And if they accomplish this mission, we're going to reduce homelessness. We now had a full bridge to services. And that relationship that we have with our continuum of care is vital in helping reduce homelessness. I contact Tara and almost on a daily basis about issues that we're having within the system. What do you have to have success? Three things that we have to have. Identify who must be at the table. A lot of agencies contact me and say, hey, we want to get involved in homeless outreach teams. We want to see what's going on. We want to see how to do this. And then they send me a patrol officer. It's like, patrol officers are not going to make change in the way a system addresses homelessness. Captains, chiefs, city commissioners, they are the people that need to sit at the table and be willing to invest the time with other leaders and other key stakeholders to make change in your community. It takes people at the table that say, yes, we're going to make this change. Then the group gets together and identifies not only differences they have about how the problem drives them crazy, but you've got to understand there's a lot of common ground that each of you has, you're dealing with, that you can agree with and say, okay, these are the issues where we can start working together. We may not have a complete response yet, but we have these 5 things that we're willing to work with together. And out of that, you're going to develop a complete response. And that response is going to help reduce homelessness. But the keys are, you've got to have the right people at the table that are willing to make the meeting. I know everyone in this room has sat down in a meeting that gets called every month that the head of the agency or one of his staff is supposed to be at the meeting, but they're either not there or they sent the most junior guy in the department there who just sits there and takes notes and nothing really gets done. The important people need to be at the table, and you need to start to put together a response.
So some of our key takeaways include looking for easy wins. Work together with all your governments, foundations, and stakeholders. Focus on shared goals, as Kevin has said, similarities rather than differences, and look for some easy wins or low-hanging fruit, particularly when you're building those partnerships to get some successes under your belt.
the partnerships is very critical. I have the phone number to the head of the organizations in our neighborhood that work on rapid rehousing. I have the Salvation Army major. I meet with him almost weekly. I meet with the county. We frequently discussing with each other and meeting with ways to resolve this issue. We have not solved homelessness in Sarasota, but we continue to work on the problem, and we continue to divide areas in where we're just not meeting our goals, and we work on plans to help address those goals. But it's only capable of happening because I have Nancy, Tara's, and they all have our numbers, and we have a communication that says, this ain't working. How do we work on it together better?
And one of my favorite things in this process, and what I have really found to be a critical learning piece from the COC level, is to understand how and what local government is funding. Nancy did a fantastic job of mapping out all the funds that are being used in Sarasota County for homeless prevention or homeless services, what types of funds they are, what they're being used for, but what they are also eligible to be used for. So we could really look at, are we getting the highest and best use out of these dollars? Is there dollars available someplace else that could fulfill this need and free up these dollars for another service? A great example, in another community, they're spending some $60,000 of CDBG money on dentures, which CDBG is critical money that's available for housing. Housing ends homelessness. Dentures does not end homelessness. While it would be nice for those experiencing homelessness to have their teeth, that's an easy ask for the medical industry or the health profession or other funding sources there. Another quick example of what can happen when you sit down and analyze available funding sources is we at the COC were funding a supportive housing project with dollars that were available from another federal funding source. So that was $85,000 that could have gone to a different type of housing project and didn't, because we just weren't looking around at other sources. We've since moved all of the people that were on that project over to a more appropriate federal funding source, and the organization that was receiving that grant is actually generating revenue off of their building with that change. And we had $85,000 to give to a different program to serve more people.
I think that, I'm sure your communities are similar to ours. When you utilize those funds for the same thing year after year after year, it becomes institutionalized, if you will, and people forget there are other sources. So the analysis that we all participated in, and then overcoming that fear of changing and jumping in has really made some differences in our community. And those funds that Tara spoke of that were freed up, that's ongoing. So those funds can be used for other more appropriate projects, not just this year, but on into the future.
And I will tell you that the funding is why leaders need to be at the table. It is not going to be easy for people to change the way funding happens. Everybody expects their money every year. And if your city has to have the courage to look at who's getting funding and how the continuum of care is spending that funding and say, we're not going to keep spending money that way. We have a by name list. We have chronically homeless individuals that are not being served. We're going to serve them. So you need to make sure that the funding is going towards outcomes, and outcomes is housing the people that need to be housed first. And there's a million ways to spend funding, but unless your objective, Suncoast Partnership, the End Homelessness, is working toward that one objective, you need to change the way your dollars are being spent.
So while there are national best practices that are translatable across all communities, we all have resources and challenges that are unique to our individual situations. don't wait until you have it all figured out and every aspect of your response system mapped out to begin, or you're never going to get out of the gate. As you begin implementation, you can tweak the components, identify gaps, and develop strategies to address those gaps. The best way to get something done is to just begin.
The biggest thing right now that is the obstacle for all of y'all, if you could all be heard, I know one thing you'd all be saying, we don't have any affordable housing in our area. Sarasota doesn't have any affordable housing either, and every time I go somewhere and speak, they all tell me the same thing. I know what you did, but we don't have affordable housing in our area. We do not have affordable housing in our area, but every month our case managers manage to house people. Your people can do it. Tara and I sure can tell you how much it costs, but an individual in Sarasota has to make at least $15 an hour, 40 hours a week just to get a studio apartment. We don't have any jobs paying that, but every month our case managers and our system puts people in housing. So that one excuse that everybody has, move past it and begin something.
Oh, we're not advancing. Okay, well, our slide seems to not be advancing. So we'll just,
there we go.
There we go. Thank you. So we don't have any questions up. One thing we did do is we made a list of Sarasota tailored programs and services. We didn't really anticipate having a lot of time to speak about these, but we do have a few minutes. So I'm going to start, and Kevin is going to jump in because these first three bullets in particular are near and dear to his heart. We have homeless outreach teams with law enforcement, and those have civilian case managers that work alongside them. The City of Sarasota created the first one. Sarasota County, working under the Sheriff's Department, also has one now. And one of our other cities, the City of Northport, is looking at implementing this component as well. Part of that was creating homeless outreach team, or hotbeds, as we affectionately call them. The city and the county together share 50 beds, and some of those are also bridge beds, and those are dedicated beds for people who are enrolled in a project that they can stay in during the housing project.
And I want to say about homeless outreach teams, everybody has chronically homeless individuals in their community that everybody says, oh, they don't want housing, they don't want services. You've got to have this outreach team, because I agree that when we started outreach in 2014, a lot of those said we don't want services. And it wasn't because they don't want services. The system had not been working correctly in our community. Our community was not addressing chronically homeless individuals. We had to convince them that they weren't on I used to call it a bus. They knew that if they went into the shelter and said they wanted services and they wanted housing, they were going to get a 3-month runaround before there wasn't going to be any housing. The system was going to put them out, and they were going to be back on that corner. It isn't housing they don't want. They don't want the bus ride. The homeless outreach teams managed to convince them this is not a 3-month bus ride anymore. We have a path to ending homelessness for you. We did that in our commitment by purchasing or renting what we call hotbeds. That is making sure every night individuals that are homeless have an opportunity for case management and a bed. We did this as outreach beds and part of our criminal diversion response. An individual that has an opportunity to be arrested for lodging out of doors has to have a legal alternative, and we talk about life-sustaining conduct. So as we move forward in our system, it keeps changing and evolving. We came up with bridge beds when we got to the by name list.
We have a couple of questions from Renee Scott in St. Lucie County. Hi, Renee. So Renee's questions are: who came to the drawing board first to end homelessness? The county, the police, the city, the COC, etc. And where does law enforcement get hot training?
Well, I would, we could probably have a disagreement on who came to the table first.
Which table?
That's a better question.
I like to say we probably all came towards the table at the same time. We just couldn't get any agreement, and the city started homeless outreach teams in 2014. Whether or not we didn't work together at all then in 2014, so I can't really say what the county was doing, but we were kind of working on our own in 2014 with homeless outreach teams, enforcement and stuff like that. Where do they get the training? The training came from Kevin Stiff, put together the PowerPoint, got the city attorney involved in ordinances, and we put the training on every 6 months in the police department to make sure every officer understood how we responded to homelessness as a city. Your police department should not be your response to homelessness. And we hired case managers for one reason. And I told the city manager for one reason. If every time someone complains about homelessness, you send a police officer, you cannot say that your city has not responded to homelessness with law enforcement. You have. They're in a badge. We also address crisis intervention training. Almost 100% of the law enforcement officers that work the road in Sarasota have CIT training. We want to make sure officers have the tools to have relationships with homeless individuals. And that's why we've spent so much money on homeless outreach teams, outreach beds, and bridge beds. We are making a difference in our community. And as I say, your city and your government needs to respond, not your law enforcement, because there's more to it than that. And in proof of that, our latest iteration is Community Care Court, which is a court for individuals, specialty court for individuals experiencing homelessness, that we want to make sure they have another alternative as opposed to jail to get out of the legal system.
And I would just add that it's always been the COC's mission to end homelessness in a community. And COCs have been in existence for a number of years, but it is always a challenge. It has always been a challenge to get at the same table with government. That's one of the reasons the United States Interagency Council on Homelessness was created, so that at the highest level they were really intersecting all the different community systems and tying it into ending homelessness. But we've always, that's what we exist for.
We have another question. I'm curious to know if your homeless population is hidden in terms of visibility, or are you still experiencing homeless encampments on sidewalks, in parks, or on other publicly owned properties? If the latter, are you employing a different strategy for those encamping on sidewalks and parks?
Yes. When we started homeless outreach teams in 2014, we had in excess of 25 camps in the city of Sarasota, homeless camps. Now we have one or two, and they're not on public space. They're usually in an abandoned field or anything like that. We do not allow people to live on our sidewalks. We have numerous ordinances that prevent that. We have property ordinances. We have a lodging outdoors ordinance. Again, in that, when you think about our enforcement of that side, we do very little enforcement. Last year, our officers arrested 0 people for lodging outdoors. Now, we summoned a lot of them to court to give them opportunity to get the services. But no, we do not allow storage of public property. We don't allow drinking in the sidewalks. We don't allow living on our sidewalks or camping on our sidewalks or in our public space. That's why a city has to respond. A city has to respond with code compliance, park and recreation, streets. All of those areas have to be involved as you maneuver through this complex phase of a response to homelessness. It can be done legally, and it can be done compassionately if you're willing to spend money to make sure your continuum of care is functional.
And in addition to what Kevin has said, on the county side, we also developed facility rules, and most of the parks in Sarasota County are maintained and staffed by county employees, and all of the libraries are as well. So we established a closing time, if you will, for all of those parks, and so that enabled our law enforcement when folks were using those parks after those hours to do some outreach and do some diversion and move people along toward either hotbeds or toward some other form of diversion in our county facilities.
In our partnership, as you can see on.
Could I jump in there, Kevin, just for a minute? We have a couple more questions, and I know we only have a couple minutes left.
Yeah.
But I would like to address these questions that have come in. You guys have done a superior job, and this slide obviously has generated a lot of interest.
So really quickly, Renee's question
before we get to that, I just want to ask if when you talk about the funding for the shelter, could you also just add to that any other funding sources that cities and counties can look to that may assist them with this program?
Well, the city and the county both fund hotbeds at the shelter. That is different than what money they would get from the continuum of care for emergency shelter. We fund these beds for our case managers, our law enforcement officers, but the city also funds an employment program at the Salvation Army as a partner. And so that works for well as well. Now, Tara can talk about funding that is available through the COC.
Yeah, so the question is
specifically any funding that cities and counties don't already receive. So if it's from some nonprofits or someone mentioned CDBG or other funding, what those funding sources are.
So it depends on the shelter. So the question is, do you have homeless shelter? And we do. We have a large Salvation Army runs our larger shelter in Sarasota, and we also have two small family shelters that are run by two other organizations. The small family shelters are funded largely by the county, with maybe a little bit of private funding depending on the organization. Salvation Army is a pretty large organization. They fund their shelter a number of ways. We at the COC provide them with emergency solution grant funding, which ESG, which is also an entitlement fund. So some counties and cities get that money directly from the federal government, which it would be appropriate for them to use that for shelter. They're also funded private donations, other types of grants, county, city. I mean, they're kind of a hodgepodge of funding sources to provide shelter.
But I would say that's why it's important for communities, government to get involved in their continuum of care and find out how those dollars are being spent. If those dollars aren't being spent to what the city and the county need to make changes in, they need to readdress those funds.
Last question was, how was your community care court established?
Well, community care court was established
Kevin, you have 1 minute.
out of the need to make it happen. We knew for years that we needed one more piece for individuals that were already in the system. How can we get them out of the system without a judicial outcome? Plus, how do we make sure that individuals that continually break the law in our city end up with a appropriate sentence for appropriate crimes? Well, I just met with the state attorneys, the public defender's office, and the judge and said, how do we get this going? So that's how I turned into the community care court coordinator. You've got to make the system change. It's not going to change by itself. You have to make it change, and we've pushed on the system and pushed on the system until we got the change.
Thank you. Thank you very much, Kevin and Nancy and Tara. Outstanding job, and too bad these questions were coming in towards the end here. Our time is actually up, but there's also a slide here. I think you have a slide on some resources. Maybe if we can move that, Mike or one of you all can just move that slide. There it is for the attendees, if they could be jotting some of that down while I make just a couple concluding remarks. And one of them, of course, is to again acknowledge the people who are presenting to you today. Kevin Stiff, the City of Sarasota Community Care Court Coordinator, Nancy Deloach, the Homeless and Poverty Policy Coordinator for Sarasota County Health and Human Services, and Tara Booker, the Chief Operating Officer for the Suncoast Partnership to End Homelessness. Obviously, they work very well together, and that seemed to be one of the takeaways here is bringing the right people at the table is what I heard more than once. And because obviously, even though this problem is universal, the solutions and the challenges can be very specific to your region. And obviously, they seem to take that philosophy as something very important, as evidenced by what they presented here. So we thank you for doing that. We also want to quickly thank the FCCMA Board of Directors, Shannon Lewis, President, and the entire board for continuing to offer these monthly webinars. And for those who have only joined us for the first time, these monthly webinars generally are held the first Thursday of the month from 2 to 3. There was a special training this month, which required it to be the second Thursday, but generally the first Thursday from 2 to 3 at no cost. These webinars are put on by FCCMA as a result of them allocating some funding for this, and as well as the partners they have that are working with them. Also want to give a quick acknowledgement to the Professional Development Committee of FCCMA, who puts together the details for these webinars. And with that, I would ask that you would take just a moment as soon as we adjourn and complete a very brief survey evaluation for FCCMA to assist them in the future. Finally, I want to thank the attendees for attending. Your attendance obviously creates value for these webinars, and we do archive all of them. They're on demand at any time at cflge.org. That's cflge.org, Center for Florida Local Government Excellence. We archive all of these FCCMA webinars. We have them for 10 years, a 10-year list of archived webinars. So please take a look at that table of contents we have there on our website, and you'll be able to select those that are of most interest to you. And this one will be the most recent one that will be added here within the next week or so. Again, thank you all for your participation. And with that, we're now adjourned.